to talk about ketones and immunity, but I think the better answer and the better first focus is to look at immunity and your immune response. Just take it back away from a ketogenic anything. And I want you to look at this little kid's injury. He scraped his elbow and it hurts. And we can all look at that, and if you're a mom or a dad or any caring human being, you're going like, oh, honey, I bet that really hurts. And the reason your brain says that is because you can see his immune system has responded to this injury. And how do you know it responded? It's that red part around his injury. Not only is there just a scrape, but his skin is going to be tender to touch in those areas where it's red. So you wonder what's going on in the areas where it's red. And this is what we call your acute or the short-term response of your immune system. So when he scraped his elbow, he didn't sterilize whatever he scraped it against. There were infections. There was bugs in the dirt in his skin. And those infections said, we've got an open door into this really rich resource of nutrients. So in go the infections. And that takes your little plasma cells and it wakes them up. They've been sleeping. They had nothing much to do. Life was pretty boring. And when a plasma cell goes from sleeping to awake, it starts to look at what their enemy is. So in this situation, I've given him a couple little bugs to fight. But as those plasma cells start to talk through your lymph system, throughout your special tunnels throughout the body, they send messages through a system called the cytokines. Specifically, the immunity of IL-1 and IL-6 are what responds. This is interleukin-1 and interleukin-6. They respond to your hurt, your infection. So as we look closer, we take those little plasma cells and we activate them. They do wake up, and as they awaken, they grab onto the bugs, they start to digest the bugs, they start to make this really important IL-6, which is what makes that redness happen. So this is in comparison. That was what we call an acute injury, okay? The kid scraped his elbow. He's gonna be fine. But when you look at this picture, what do you see? Do you think that is a recent injury? It's called psoriasis. It is an inflammation inside the skin, and it has taken years for his body to allow this to happen. This is a defection in his immune response. His immunity is now recruiting plasma cells just like that injury did for the scrape in the elbow. But these plasma cells are much higher in number because they've been signaling for a long time. If you take a biopsy of that skin, we can find some infections, but what we really see is high levels of inflammation. I put in a bunch of inflammatory cells or plasma cells and I threw them in with a flame because when you ask this guy, what does it feel like? He's like, it itches. Sometimes it's really hot. He's going to have less symptoms at the site of this problem and more symptoms within his body. As you say, well, you say this has been going on for a while. What else has happened in your life that would relate to your health? Answer is also, doc, I've been real tired. I've been stressed lately. I've not been sleeping. I had a major event in my life a year ago. Since then, it's gotten so much worse. And you will hear them describe what it looks like to be under chronic stress. So as we look at how can I, as a physician, predict who has a poor immune system? Whose immune system is filled with interleukin-6? And the answer really shows up with looking at insulin. Yes, I do demonize insulin. And insulin looks like this big flame with this really big forehead. The insulin guy is known for being in charge of taking care of these little characters, which are my glucose. So glucose, I match with insulin in color. They're both red. And when the glucose is elevated, the insulin's job is to tuck away when you have more than about a tablespoon or 7 carbohydrates in your circulation, your body will store it away. Well, if you have, let's say you had 8 carbohydrates and your body said, oh, we need to put a little bit away, it would give you a little bit of insulin and then the insulin would tuck away. There would not be any flames with your insulin. But if you have excessive consumption of carbohydrates to the point where the glucose becomes this major focus of your body because you are adding glucose. And by golly, insulin will not let that go unnoticed. He grows larger, the inflammation associated with insulin gets worse, and that body inside starts to fail. And by fail, I mean the response that you should be having for every little invader that comes in. Your system gets weaker, it gets slower. The response of all of those hormones like interleukin-6, they failed. They are not doing what they're supposed to do. And as a result, the insulin grows louder. If you ask this man with psoriasis, what does it feel like to have psoriasis? He won't say what the little boy said, which is, it hurts, don't touch it. If you push on it, I don't, you know, they'll cringe. He doesn't have any of that. His inflammation is so chronic that it has done something to his skin that we can see. And that's why I picked psoriasis, because it's on the outside. We could have picked a lot of other things like lupus or chronic fatigue syndrome or depression. They are all linked to an increase in interleukin-6. And your immune system will be slower when interleukin-6 is that high. Now this is me weaving together some of those glucoses and then showing you that the big enemy is insulin, and I demonize insulin, and I get lots of people that write in saying, yes, it's vital for life. Yes, it is vital for life. But it is so overused in the audience that I see day in and day out that it almost is more of an enemy because of its excess. Now, you still need insulin to live, so don't get me wrong. But the real punchline here is, as you predict who's going to have the hardest time with getting an immune response, it has everything to do with what's been going on for the last several months. Getting this insulin down so that your system has a chance to reset these fat-based hormones, you will enhance your immunity, but it's not going to happen overnight. In fact, if there's one reason that quarantine needs to last 6 weeks, it's if you started the ketogenic diet today, you would have a whole beautiful new crop of cells fighting for your life in 6 weeks when you enter the community again. So that man with a chronic illness, with a chronic psoriasis, if I said to him, I'm going to treat your psoriasis by stopping carbohydrates, he would look at me and say, I paid my copay for a cream. I want you to treat the skin problem. And I would say, okay, I can put some cream on there, but it is not going to fix the problem. The problem comes from deep within your bone marrow, within your cells, within the hormones that talk throughout your body. And when we give you the really high dollar ones, the ones that your insurance is really trying to find a way for you to not select because of its cost, but also it's really hard on the human body. And those are some immunomodulators. They're trying to go into your white blood cells and turn how they work. And the good news is it can stop attacking your skin, but it makes it so if some kind of virus comes into your body or you get a scrape on your knee, the bugs that come in there are also going to have an advantage because you took a medicine that stopped you from fighting infection. So instead of trying to block off part of your immune system, restore it from the roots, which is what a ketogenic diet does. Again, a ketogenic diet is not a place where you eat. A ketogenic diet is a chemistry set. So you just saw all those ketones come out of the liver. Your body makes ketones primarily out of the liver. Almost every ketone that you make comes out of the liver. And when I ask patients with, like this psoriasis patient, if he came in and said, but I'm having a tough time giving them up, how can I get ketones in circulation without, the strict diet? I would say it's much better if you use the diet, but if you put that special oil, the MCT C8C10, into your system, there is a portal vein that goes from your guts. It picks up nutrients from your guts that are this very specific size, MCT C8C10, make sure the label says that, and puts that oil right into your liver. And the only thing your liver knows to do with this is to make a ketone. So even when insulin was really high, MCT into the body could raise those ketones to a point where it was strikingly improved.